at NPTE, we love to talk and educate our PTs and PTAs students, not just about the boards and NPTE, but much more than that, like through your DPT journey, as well as your clinical life, clinical rotations, and then moving on, life after NPT as well. We are there for you. We educate, advocate for you guys. So yeah, I know many of we might have met at San Diego at CSM last month. And today I'm here to discuss some tips and strategies which I think that have helped me. And I have kind of presented that to my students, and it has helped them a lot as well. So I'm going to just share my screen. And everybody can see my screen? Okay, perfect. Okay. So yeah, let's know a little bit more about me, and then we'll talk about you guys as well. So who I am. I am a licensed physical therapist in the state of Texas, and I also hold a license in the state of California. So I work in an outpatient setting. That's advanced orthopedics and sports medicine. That's an outpatient clinic in Houston, Texas. And I am also a board certified specialist in orthopedics physical therapy, that's OCS. And because I am here with you guys today, I am also an instructor at NPTE Final Frontier and a lead instructor at OCS Final Frontier. I am a huge advocate for our foreign trained PTs, and that's why I'm also a vice president of an organization which is especially for foreign trained PTs, that's FACTS, which you see over here. And then I am also a fellow in training. So I'm pursuing my fellowship in orthopedics and sports manual therapy from IAR Houston, which I'm sure you will, or you might have heard about them. And then I did my doctor of physical therapy from Loma Linda University, California. And I am also an APTA certified clinical instructor. I do take students from many universities in Texas and out of Texas as well. And overall, I am a proud alumnus of NPTE Final Frontier. And that's why I vouch for them. And most of our team members are alumni. So yeah, it is that we did a best decision kind of doing and going ahead with NPT preparation with them, but we have to talk a lot more than that about our preparation and everything. So I'm also a mom and a wife. I have a beautiful 7-month-old daughter at home, and yeah, so let's now get to know you guys. So Daryl, can they type in the chat? Or would they be able to type in the chat?
I believe I adjusted the settings so everybody could type in the chat. Okay, perfect.
So I would like to know a little bit more about you. So which part of Texas you are currently at? So whoever in our student panel, tell me, where are you from? Austin. Great. Dallas, San Antonio. Anybody from Houston? Dallas. Central Texas. Okay, great. Now my next question is, are you in PT program or PTA? Because I know this organization is for both. PT. Okay. So DPT. Okay, perfect. PT students. Okay, perfect. So which school are you from? I want to know more about that as well. Which school? Which school is going to get the highest attendees this evening and our 25% discount on the course of your choice? TWU. I used to have a few students from there, and St. Augustine as well. Angelo State, Baylor. Yay. Nice. Okay, great. Okay, so which year you guys are in? Which year? So first, second, third year, or so my next thought would be, when are you taking NPTE? Third year, final year? Good. Second year. Okay, there's some time for second years to take this exam. So it's a good time to kind of get into those tips and strategies and kind of building yourself up. Okay, second year. Good. Okay, Marisa is taking July. That's close by. Anybody taking April here by any chance or no? Like, I don't see anybody saying anything about that. Okay. So have you guys heard about Final Frontier? You guys met us at CSM. Okay. Anybody knows about Final Frontier? Yes, no. Heard only a little. Okay. Okay, that's okay. CSM. Yes, we were at CSM. And we always go to CSMs. So yeah, there's always a booth for NPTE Final Frontier. Okay. Thank you, Miko. Yeah, I've heard that too, and I believe that it's one of the best things for board, especially if you're preparing for one right now. Okay, so our idea overall, when we talk about NPTE, we know that after your DPT program, you do your exit exams, and then next thing is to sit in the boards and take your exam. So your goal is to pass the NPTE and see the screen, which you see on here right now, which is passed, right? That's the dream of every student PT who is about to enter this rewarding profession of ours. And now, how to achieve that? Do you do a lot of hard work, like going on to each and every book and every page of that book, which you had to maybe undergo in your school, or all the notes which you have taken so far till second year or third year? What you do, or you have to pass this NPT by design and not just luck or hard work, like too much hard work. You need to put your hard work, but not too much, right? So definitely let's talk about that design, like what you at a personal individual level has to do to make sure you are achieving your goal in the first go. And yes, whatever you've been studying and whatever you have been working, like if you're, especially I know some of you are, you must be doing your rotations right now. And yeah, the boards are approaching, and what are those strategies which you should be applying at this point of time before you take this exam? So what is the recipe, or what are the plan? What is the step-to-step approach? Okay, so let's talk about the first thing first, getting yourself into a routine. Okay, so anybody who is in second year right now, I'm not gonna be like over onto you that you have to start preparing for NPT right now. No, it's not the time. But somebody who's in the third year about to take boards, we know nobody's in April right now here at least, but somebody who's taking in July, yeah, there would be like 3 months time at least. That's what you got to give yourself, because life is not just sitting and studying for NPT. You have to go to your clinicals. You have to have so many other responsibilities. Maybe you have kids, maybe you have some other responsibility with parents or a side job which you have, and you have to take out time to study for NPTE. So setting yourself into a realistic routine with the ongoing life, that's what I would say we have to kind of make sure you do. Now, sticking onto the routine example, let's talk about that. Now, if you're a morning person, but you go to clinicals or rotations, and then by the end of the day, you're so exhausted, you're trying to study hard for those few hours, but it's not helping because it's not going to work, because that's not your style, that's not you. So in that case, it's better to work on that thing and change whatever we can sooner than later, right? So if you know that you're a morning person, you should be taking out time in the morning before going to your rotation, or having a time set up in a way that you have some time in the morning, and you just come back in the evening, relax, and just done with the day. Okay. So that's when you know what works best for you, and sticking to that study plan with no distractions in the time. So distractions can be anything with us. Distraction can be sitting with your phone while you're trying to study from your review book, or you being on Instagram because there's some story which is interesting, or TikTok. So we got to make sure in that routine, you're taking out all those distractions for that certain amount of time in which you're paying attention and studying, right? So for me, when I took my boards in 2017, I had Final Frontier. During that time, it was a very small organization, not as big as now. But just the plan which they gave me, especially the timetable, that helped me to organize my routine to sit and study for the exam, which I'll talk to you guys a little bit, how to make your timetable, how to kind of stick to something, which is, whichever review book or course you are getting into, just understanding that you need to organize yourself into a routine. Okay, so yeah, that's one thing about the routine. But also, I would say that when you're studying, routine is one thing, but then you are like, okay, what all books I'm gonna pick up to study for this exam? So there are tons and tons of books. Yes, there's lots and lots of resources which are present over there, but you cannot have everything and studying everything for this board exam. So you got to be smart. You got to be very picky in the books and material which you got to be focusing on, and not like having Dutton and McGee and another ortho book to study ortho. You just have to stick to one and kind of go over that. But I'll talk about that a little bit more in just a little bit. So the idea here so far with the first thing is to make yourself a routine and sticking to it. Now, second thing is timetable. Now let's dive into more of this, that what and how to make a timetable. Like, why would you need that? So making a timetable for yourself, organizing yourself for that 10 to 12 weeks ahead to, before taking the exam, it would be very crucial to organize yourself. With all the busy schedule you're into, you might be graduating, so you have to attend a graduation, or you have a friend's wedding, or you have your own wedding, or a clinical rotation schedule, which is really tight because your clinical instructor is really strict about everything, or you have exit exams. So in that case, you got to have some time and timetable set for yourself. So by that, you would be focusing on your strengths and weaknesses, but especially prioritizing your weaknesses when you have that timetable in hand. If you know that you are strong in musculoskeletal system, you are not going to spend a whole lot of time in that, versus when you know you're weaker in neuromuscular, which is neuro. So in that way, you can put more time in that one thing and make your weakness as a strength by the end of that 10 to 12 weeks, which you are studying in. Okay, so you got to give your time for the big systems, especially which you would see in the exam. The big systems in the exam, which you would be tested on, would be MSK, then it would be neuro, then third one would be cardiopulmonary, and then goes down to other systems and non-systems and everything. So the big three are the MSK, neuro, and your cardiopulmonary. So what I would make sure I do is making these big three systems very strong for this exam, because those are the foundation and those will have the highest weightage in the exam. So that's what is recommended. But when you're making a timetable, you got to make sure in the beginning of, like, let's say it's the week 1 of starting to study, you want to keep that first week or first few weeks on the basics of everything: MSK, neuro, other system, integumentary, etc., etc. So that's how you're going to build yourself into more complex content areas. Don't start with something like, cardiac rehab, or, details about anything, protocols, rehab protocols. Because if you don't know, let's take an example. If you don't know what is ACL, I'm not saying that you don't know, but yes, you don't know what exact special tests can be done for ACL injuries, but then you're straight away going ahead and studying the ACL, then it's not gonna make sense. Like ACL rehab, it's not gonna make sense. So kind of talking and studying the basic ACL, is restraining which movements, what is the mechanism of injury, and what are the other structures present around ACL, which can also get injured when there's injury, or etc., etc. So kind of working on the basics in the beginning of your timetable, and then building yourself up to more complex content, and then kind of building up to the end for your revision. So you got to make sure you make a timetable, which is setting you up in a way that at the end, you have a lot of time for revision as well, because that would be crucial for this exam. Okay, so that's how you got to do the best you can by following what you know your strengths and weaknesses are, and not just going on to what others are telling you, like, oh, no, you should go with MSK because that has the highest questions. Yes, they are. But if you're strong in that, you might not have to spend so much time, right? So that's my idea on making or having a timetable set. So that's what would be here. Now, the third thing I would talk about, and I would highly recommend doing this, is what we call as active learning when you are studying for this exam, as maybe you were doing when you were, working on your labs, where you're like doing active learning. It's not just sitting on the side, reading a book, like just flipping on pages and not understanding anything. Is just the time when you got to stop. Like that's the time when you need to understand, like, oh, it's not going, and nothing is going inside my brain. So active learning as in, I would say some of us are visual learners, some of us are auditory learners, some of us are kinesthetic learner, and most of us are kinesthetic learner, I would say. So know your style, first of all, but make sure that style is not passive. Okay. So yes, that's one thing I have understood when I was taking my exam. It was like studying by yourself and just reading the books is not going to help. I don't want to tell you guys this, or I would not recommend doing this, but when I was studying for the exam, I had to review all my biomechanics, because previously I had all my clinical rotations in spine clinic. So what that made was that I was very good at spine in MSK, but I was like lacking in all other joints. So what I was like in my head, I knew that I have to revise all my biomechanics. In that way, I picked up Newman book and I literally read each and every chapter. But then after 1 month, what do I realize? That it's not a good thing, because they don't ask biomechanics, right? It's not just the biomechanics which would be asked in the exam. So I needed to keep that away and work on more of how the basics were, and going to the test questions, like test questions as in practice questions, and again, getting the idea, how do I study, what exactly, how they make questions, what exactly they ask in the questions, and then study accordingly, right? So you don't need to know bones and things and all of this. So that's why we got to study smart. And active learning would be something when you are studying something and you are discussing that with your study partner or a friend whom you had, like you understand their idea of learning style, and it kind of combines good together. And then you are teaching each other, or you're teaching. If you don't have anybody to teach or listen to, then I would suggest standing in front of a mirror or something and just teaching yourself. If you're able to do that, you know that concept very well, and that's done. Okay, that might just need some revision, but you know that content really well. That's why you're able to, talk about that topic, and the other person, or, the person who is in front of you is able to understand that. And yes, that's a win-win situation for both of you. So that's what I would say. But other than that, I would also suggest whenever you are learning, so learning style wise, yes, but for this exam, you have to be an advocate of yourself. Look, advocate as in, you got to wear your advocate clothes and ask yourself why, what, how, everything about, what is coming in front of you. Now, let's take an example of what I'm trying to say here is, why Lockman test is better than anterior drawer test for ACL. Like that can be one of the questions which can be form and asked in a way. So we know both of the tests are for ACL, but why one is better than the other, right? Then next example would be, okay, we have Hawkins-Kennedy test, which is for XYZ condition. They're not going to give you the condition, but they're going to ask you which other special tests are present or we can do for this patient. So Hawkins-Kennedy is a test for impingement. And then there are other tests like Neer's test, right? And then Yoakum's test, which can be done for the same condition. So we got to understand is just not studying like passively, but understanding and asking yourself what, how, when, where, right, of everything. So that's going to be an active learning process as well as you go ahead, okay? Other than that, making flashcards, review charts, sticky notes, that all will help, especially those things as flashcards and review charts are very beneficial if you have something like outcome measures or something which is lab values, which are volatile. Like you need to do that again and again. It's not a concept. Like RBC normal value is what it is. It's not a concept, but it's like, yes, that's what you have to memorize. So all those things which need memorization, I would definitely make sure that I am putting some extra effort and making like flashcards or review charts or a packet, which I would be reviewing each like now and then. It can be before every practice exam or after or closer to the exam, actual exam when you're like 2 weeks away from the exam, okay? So that would be my active learning process here. Now, coming on to the next thing will be very importantly for this exam, we gotta self-test. Now, self-test ourselves is in one or the other ways, but most commonly, the most common way of understanding your position, how are you doing for this exam, is by taking multiple practice exams, okay? Those practice exams should be kind of every 7 to 10 days when you have started preparing for the exam. So let's take an example of this one. You are, keeping yourself 10 to 12 weeks time to study for this exam, okay? And in the beginning, you don't want to take the exam like really immediately, but let's say you have that little phase of 2 to 3 weeks where you have you have gone through all your basics and now you start with your practice exams. So how many total practice exams you can take or you should take, which is recommended, 6 to 8 exams, okay? 6 to 8 practice exams is something which you would take, and you would take it every week once you're ready to take it after you're done with your basics. That's when it's recommended. And the recommendation from my side, and anybody who has taken the NPT before will give you the suggestion that you should take a full-length exam, full-length practice exam, which is 250 questions exam and not less than that, maybe like 200. I know there are some books or some kind of courses which do that. Not a problem. It's not like something which I'm kind of completely against about. But let's understand why. Now, why behind this is that for the exam, the actual NPTE exam, that exam is 5 hours long, right? Now, for that 5-hour long exam, you want to make sure you're building your endurance to sit in that exam. And that will come up only by practicing again and again for this exam via practice exams, right? And if you're taking practice exams, which are 250 questions, that is something which is replicating the actual exam. So in the actual exam, you have 5 sections, and every section is 50 questions each. You get approximately 1 hour to finish each section, and then you kind of, submit your exam and you're done with the exam. But it has been studied that, and it has been studied by FSPPT, that there is a tendency for students to get fatigued, especially after after the 4th section and going towards 5th section, which what happens by that is What happens is that you start getting your questions wrong, even though you know your concepts, even though you know the thing, but then it kind of reflects on your score that, yes, the performance has started to kind of go down. So that's why it would be important to be able to sit for 5 hours when you're practicing. That would help you long way, and especially help you on the D-Day when you actually need that endurance to be able to kind of tackle it all through, and you're not fatiguing, and you're not getting any kind of, and you're not anxious that, oh, my time is running. So that would be important thing to do. That's one thing. You have to build your endurance to be able to sit in the exam. But what is the other thing? The other thing is to review those practice exams. So that's important and a crucial step when you're prepping. Okay, so when we say that you should be taking, it's preferred that you should be, or it's recommended that you should be taking a practice exam every 7 to 10 days. So every week you're taking one practice exam. So let's say you're taking an exam on a Saturday. Let's say that. Okay, so you spend like 5 hours in the morning to sit for this exam, study for this exam, and then fine. Do you start the revision, or do you review that exam? Yes. That is the vital part, that you need to review all your questions. Now, the second question is, should I review all the questions on that same day? Like I should sit on Saturday evening and do all my 250 questions? Oh, don't do that. Ever don't do that. Don't be a person who's just skimming through those questions and just done. So why is that? Because you want to make sure you're spending quality time for reviewing those questions, those practice questions when you have taken the exam. It's highly recommended on that day when you took the exam, don't study, don't take a break, simply take a break. Don't review your questions. But the next day onwards, you need to review all the questions. And I would recommend, and we at Final Frontier, we recommend that you should be taking only 50 questions per day. Okay, don't sit on Sunday and do 250 questions revision or reviewing. No, don't do that. So one thing, you have to review all the questions, even if you got them correct or wrong. The second thing is that not everything in one day. So you got to split them out into 50 questions and give yourself a good amount of time to review these questions. And kind of, there would be questions where you're like, I don't know this concept at all. So that is a perfect time that you can open your content books and then review those questions, or review whatever the references are given in that question, so that you don't make that mistake in the exam when similar concept is asked, not a similar question maybe, right? So that's something I would highly recommend, that put it into parts and definitely review all the questions. Now, this is one of the things which I get to know from students. What they do is they'll keep all the practice exams for the very end before the exam. Don't do that. You have plenty of time if you are sitting for 12 weeks or 10 to 12 weeks to be able to crack this exam, right? So you want to make sure that you are starting to take your practice exams from the very beginning, maybe not the first 2-3 weeks, but then every week consistently you're taking it. You're being accountable for that, right? And then take your PEAT exams as well. That is from the EPIS-PPT. That's another one, which is a gold standard to kind of see that where are you at, right? So that's about the self-testing yourself. That's going to tell us the weaknesses and your strengths, and then you can work accordingly on those weaknesses as you go forward after taking that practice exam. Okay, now next one. As I said, accountable. Yes, we got to be accountable of everything which we are doing for ourselves, right? We have to sit and make a routine. We have to follow a timetable. We have to take these practice exams, and we got to take breaks in between. We got to make sure that we are doing all of the things which are a recipe to success for this exam and get yourself licensed soon, right? So that's what we are going to do, and we are going to be accountable for our own things. So you have to be accountable, to be understanding what are your weaknesses and strengths, and not follow directions from anybody else from outside because they are studying MSK before the exam and you have to do that now. That's not something which you would be doing, right? Okay, now next thing is exercise. We definitely are going to say that whatever, you practice what you preach. So that's something which will come here as well. We definitely, when you're studying for this exam, I know that it can be overwhelming. It is overwhelming for many of us because it's like testing environment and you cannot stand and you listen to all these things. You cannot put this and that kind of clothes, and you would be sitting in the camera, not the camera, but a computer for like 5 hours, and you would be taking these exams. It builds up anxiety. It does. To any good test taker, it does build up anxiety. But it's fine. We have a lot of things which we can do in regards to reduce that anxiety and improve our focus and be positive about our planning and trust the process, right? So exercise would be one thing which definitely we all know as PTs what is the importance of this thing. So I'm not going to tell that, but definitely it improves or reduce your anxiety levels. Exercise has proven to improve sleep quality, which is definitely important, for retention and focus of your studying and everything, right? So not just exercising here, but overall just taking breaks. I have known students who would be like, okay, I just sat for 10 hours straight or 12 hours straight, and I just don't get up, and I just don't have my food. I can't have my breakfast until unless I have studied so and so things. I will leave my lunch. I might not have my dinner. No, don't do that. Don't be hard on yourself like by doing all those things. You got to take a break. And it's kind of studied, it's researched that you cannot focus anymore more than like 45 minutes to 1 hour. So it's okay to take a break after that time, just a little bit time or more time. If you're like not feeling good, you had been studied for 2 weeks and you're going to your clinicals and you're exhausted, just taking a break and being with family or doing whatever you love is something which is highly recommended, okay? So it's not like when we say 10 to 11 weeks of studying, it's not just studying, it's taking breaks in between and being able to do what you like and not just be anxious about this exam, like what will happen? I don't know what's going to be. I'm not scoring enough in my exams, and that means I need to put extra hours. No, it's not like that, okay? You got to be positive about yourself. And you got to take all those practice exams, score positively, not negatively. If you're not scoring enough, it's absolutely okay. You need to understand that you're going to review that practice exam. You're going to come to conclusion that, okay, XYZ system is my weakness. And yes, that self-realization is going to give you an opportunity so that you can go back to your content area and you can make that area stronger before the exam. So let's take that feedback positive, what you get from your exams, practice exams, and learn from that and not repeat that mistake, right? So that's what I would suggest doing here. And then after everything, like repeat. Now, what repeat? Or repeating the exam? No, it is revision mostly. Okay, so whatever the content area you had studied, let's say you are weak in GATE. Okay, and you understand it, but then you tend to forget the compensations, and then when it comes to the questions, you're like, oh, again, I got that question wrong. So what the idea would be, you cannot, for this exam, there's so much of content which you have to cover that, yeah, it's like, okay, you need to be smart enough and you have to make sure if one thing is your weakness, if the compensation of GATE, compensations which you see in GATE, that's your weakness, you got to make sure you are reviewing those topics again and again. Revision is the key. Revision would be a best friend for this exam because it's going to tell you, oh yeah, you remember or you don't remember. And if you will consistently do revision of a particular system or Whatever is your weakness area, it will become strong. Trust me, you will do that and you'll thank me for that. Like, oh yeah, it needs a lot of revision. Yeah. So wherever you can put some hours on revision of the previous things, that would be great. And one of the tip over here from my side would be that before every practice exam, like a day before every practice exam, go over your important weaknesses. Okay. And that will, if you're taking 7 to 8 practice exams, you're going to review your weak area 7 to 8 more times. That's apart from the actual time you study that topic. So what that will do is that's going to just increase your confidence by the end when you're going to sit for that exam, because now you know that content area the best. You can explain it to everybody and you know in and out because you have reviewed it so many times and you know it in and out, right? So that's something is going to help us. And what's going to help us to see that past screen when you are done with the exam, and 1 week later you see that screen in your FSPPD account, right? Okay, if there are any questions related to this here, like the approach which you should be taking, let me know in the chat. Are you with me? Do you have any questions? Is that helpful? What do you feel about it? I would love to know in the chat. Great, Natasha. That's a great feedback for me. So yeah, like that's something which I would definitely make sure you are engaging yourself into, and that would set up a plan for success, right? So that's something which is there. Now, I would like to also talk about Final Frontier and our numbers over there and our success rate and what all we have to like have in our like hand to present like in everything about Final Frontier as well, because we love Final Frontier overall, because I'm from there, I've studied, I've passed my exam from them. So yes, I am a big advocate, and whenever I can talk about them, I would definitely do that. So NPTE Final Frontier is a prep course, and it is one of the most popular courses out there today. Like I know at CSM, we get to know a lot of students who have passed with us. They come in and definitely thank us. And there are tons and tons of testimonials, which I see on our Facebook group page, but also on the DPT student group page, where they talk about highly about the NPTE Final Frontier, how it has helped. So just kind of to let you know that, yes, we have a pass rate for DPT students of 97.6%, and that is the highest among any other preparation program. And we have partnered with so many universities in US that we are seeing that increase in number more and more. Now, what exactly is inside? What exactly do we do? So yes, we are a program where we meet the students weekly, and it's an 11-week program where you have lots and lots of lectures. No, not a lot, lots of. It's like you meet 2 to 3 times a week with the instructors, and especially you would, if you don't know Dr. Bhupinder Singh, he is the PhD professor as well as the founder of NPTE Final Frontier. He had been our, the backbone of this program, and his ideology and his vision is what we are taking forward, which is helping students and not taking advantage. And we are not here as whole team. I can vouch for everybody who is on NPTE Final Frontier that we are not for money, but we are there to help you guys to be able to achieve whatever you want to achieve in this profession, from your DPT school to out of the boards into the field, everything. We definitely are there for you guys. So yeah, that's one thing. But for the NPT preparation, there are lectures, as I said, there is a detailed daily schedule. So we do have a timetable over there. We do have everything which you need to study, which means in the timetable, actually, we have all the readings from important textbooks, which are going to show up on your exam, like exam as in FSBPT does a survey in which they check like all the schools, all the DPT schools, which all books are the most used ones, and then the main ones are from where the questions are formed. So what we do at Final Frontier is we are not wanting you to study whole books, but we give you pages or important topics to cover in that timetable. And it's very organized because it starts from how you should know your basics to more complex material and going into more deeper areas and then revision of everything. So it's very organized. That's the first thing or the best thing I feel is about the Final Frontier, because I didn't have to put my brains in like what I'm going to get up today in the morning and what should I study, and I was not lost. Why? Because I had that timetable and everything which we need to do for this exam. Everything is inside that. We do have live and recorded lectures. I know both of the courses are very popular, but sometimes recorded. So that's a study bundle, which is importantly famous with DPT students. Why? Because you tend to watch the recordings at your own pace as they are uploaded on the course page. And yeah, you don't have to sit for the live classes if you are somebody who's driving back from work or your rotations and you are not able to attend them live. So it's more recorded lectures and it's more at the ease at your, like whenever you want to watch the recordings. We do have complete practice exam, which is 250 questions, MCQ style questions, and there are 3 practice questions, practice exams which we give, and there are multiple mini exams which we have and a lot of quizzes which we have. So the whole idea is we need to solve a lot of questions on a daily basis, as well as I said, for building endurance, we need to be able to take that 5-hour exam and need to take practice exams, which are 250 questions. So yes, so both the courses, the full life course and the study bundle, has the timetable. So it's like everything you need to do on a daily basis. So it has like timetable. Let's say today it's stroke, tomorrow it is MSK, differential diagnosis for knee. So it's very organized from, as I said, like it's leveled wise. In the beginning, we don't want to overwhelm you with a lot of information, a lot of bigger stuff, but we want to keep it for the middle of the program, and that's how you would see that. And then we have a lot of support system from our alumni, I would say, because all of them are or were students at some point at Final Frontier. I had taken my board exam in 2017. At that time, we were like 50 students max to max, which were there. But now, and there were like 2 or 3 team members, but now it has grown so big. It's not even 25 now. This is an older number, but it's more than 35 towards 40. So yeah, that's one of the areas. After you're done with your board, you can always apply in Final Frontier. We're always looking for people who have drive and want to help other students who are in this process. And yeah, so that's what it is about. Now, coming on to a little bit more, what else do we offer here? There are a lot of free stuff which we offer, because again, our vision is not just collecting money, but it's giving and kind of just going ahead with the vision with what Dr. Singh has set for everybody. So integrity, excellence, attention, all of those important things is what we make sure we have in the program for you guys. So attention is being provided on an individual basis, and we have, again, a lot of support for that. Email support, text messaging support, wherever you are stuck in content area or anxiety or XYZ reason can be there that you're not able to take the exam, or you took the exam. There was a situation in the last cohort with one of my students where she accidentally hit finished the exam at the end of 4th section, and she was not able to take the 5th section because it was submitted. So obviously all those situations where you might need a little more extra help or a little more extra, just mentoring or talking to any of the team members, that's always available. But we do have a Facebook group, which is there. And we usually post daily questions on that, Instagram content. Again, there's content related posts and any information communication is there. And we have a lot of questions which we post on these accounts. And then we have free podcast, which is actually the #1 in the NPTE. There are a lot of other podcasts as well, which are available. But yes, this is one of the highest one as per the ratings which we have received. And then we also, not just the live courses or the study bundle, which is like, okay, the main thing about this program, but we also do small group tutoring sessions or coaching, I would say, in which the licensed study partner, which would be one of the team members, they group up 10 to 15 students together and they discuss the content areas which are the most important for the exam, or you as a group are weak in. They would be discussing and kind of doing those discussions. So that's extra help which we provide. We do provide one-on-one sessions as well for somebody who is struggling with one particular thing. Maybe it's just, you want to go over surgical protocols, or you just don't understand stroke as well as you understand your MSK. So one-on-one attention through one-on-one guidance from one of the team members who is, again, specializing in that specific area. That's what we do. Independent study bundle is something which I was saying, study bundle, where it's more recorded sessions. You just don't meet the PhD professors and other board certified clinical specialists, but it's more recorded, but it's the same content. It's just the recorded of the live classes, which is there. Again, 3 full length practice exams are there, along with a lot of small quizzes and 2 mini exams, which would be very beneficial for you guys once you are into the timeline when you're taking your practice exams. We also do have a free NPTE Final Frontier app, and then we do have a Telegram monthly service. So there's one which is for everybody who is in the full live course, and the other one is more of a subscription basis, which is a monthly service in which you can ask it. In both of them, you can ask your questions, and mostly the Telegram monthly service one, it would be the licensed study partners or some of the team members would be answering your questions, and those questions can be anything related to the NPT or the preparation, or any issue in regards to your license, etc. We also, we have also a lot of things after you're done with your NPT. We have Career Final Frontier, which helps you with the recruitments and also kind of engaging and understanding how to make resumes, or how to kind of go over with the negotiations with the new companies when you are like freshly going into the field and getting your first job. Is just sometimes a difficult situation or difficult conversation, which these days, I understand with the Medicare cuts and everything, we think that we are supposed to get less, and we kind of go for that. No, the salaries should not be changing, and you should never be taking something which is like 60 or 65,000 yearly. I would never be one of the persons who would be, saying that, yeah, take whatever you can when you have your first job, I would say. Other than that, we do also provide OCS Final Frontier course. It's another prep course that is when you are ready to take your specialty exams. So not right now, but maybe in future. That's another area which you can kind of explore, or just follow us over there. Now, let's not talk too much about what we have at Final Frontier, but let's do one question. Obviously, right? We are here today and we should be solving a question, because we're talking about NPT, which is question. Like, you have to get those questions wrong to be able to get that 600 mark and that scale score out of 800 to pass this exam. So just let's do a simple level 1 question on cardiopulmonary, and let's see what you answer. Now, what I would do is we don't have poll. You just can type your answer in the chat and we'll discuss that. Great. I've started seeing some answers in the chat. Good. Yay, everybody is getting the right answer. Okay, easy one, right? Yes, you will see such easy questions in your exam as well. But if you're somebody who's like, okay, I might need to review it. So let's go ahead and talk about this question. So I'm going to read this question for you guys. So this one says, a 40-year-old male patient reports of shortness of breath and swelling in lower extremity. During the baseline examination, the patient or the PT experiences patient's heart sounds before starting an exercise program. Which valve is being auscultated in the picture shown below? So there are 4 options: mitral valve, pulmonary valve, tricuspid valve, and aortic valve. Okay, so I would want some help in the chat here, that where exactly is our mitral valve? Which exact intercostal space you're going to say that you're coming, you understanding this one? Chat wise, let's see who's going to type. 4th, 5th, 2nd, 5th. Okay, a few more. It is the 5th. 5th is gonna win. 5th, 4th, or 5th. Yes. So we need a little revision here, right? We'll quickly talk about that in just a little bit. So pulmonary valve. Which one is this one? Is it the second one? Second. Good. How about the tricuspid valve? Tricuspid valve is, anybody? 3rd or 4th? It's 4th. And aortic valve, where is that? That is again second. Okay, we need to quickly review it. Okay, so for this one, I understand like they might ask or they might not ask that information about the intercostal space, but there's a mnemonic for that one. And that's what we would want you to know. Like, okay, there's one thing, oh, anatomy, surface anatomy, it's just memorization, right? There's no concept behind it. The heart is placed like that inside your thoracic cavity. So it cannot change. There's no concept behind it. So we need to make it more easier for you guys. So what are we going to remember is apartment number 2245. Now, number N will change to M here. M, N goes together, and that's why we're changing that. So A for aortic valve, that would be second. Pulmonary valve, that would be second again, but it would be on the opposite side. The tricuspid valve, 4, and the mitral valve would be 5th. Okay, so that's the idea here. So quickly, we'll look into an image over here. So these are our valves. Okay, so pulmonary valve, aortic valve is on the right side second, and the pulmonary is the left side second. Then coming on to the next one, this is your mitral valve, and then tricuspid valve is towards way closer to the sternum, right? So that would be it. Now, what do you guys think should be the answer here? Looking into this image back again, should be A, or it can be C as well, right? So the idea is here, the answer is A, okay? But the idea here is that you got to remember your mnemonics when it comes to concepts like this, which is not like, okay, you might have to think a lot. You have to go back into your anatomy and physiology to kind of think where exactly are these valves, but just kind of having a mnemonic to help yourself. That's going to help us, right? Okay, good job, good job. Any questions here for me? No questions? Then I will go ahead and talk about a little bit more about the phases and about the timetable, which I was kind of talking about before. So in the Final Frontier, how we have these 3 phases in which we make sure that we are going over 1, 2, 2, and then 3. And I would want to kind of compare these 3 phases to our rehab protocol. So somebody who just had a surgery coming to you in that acute phase, and then subacute phase, and then chronic phase. So how that progresses. So phase 1 in our course is more towards acute, where you would want to stick to basics. Okay, so this would be the phase where you are working on your and making your basics more stronger than anything else. So basics of MSK and neuro, so which means your dermatomes, your myotomes, your muscles, your function, your MMT, because you can get those simple questions in a complicated manner. Okay, so those simple questions are very well asked to you in the exam. So yes, definitely those basics, ligaments, what are the ligamentous injuries? So all those things, cranial nerves, perceptual disorders, those things you got to tackle in the first phase. We are not going to give you guys more complex things in the first phase, which is example, let's say maybe, how to do manipulations on the day 1, or how to do the cardiac rehab. What exactly are the phases of cardiac rehab? So not that, but just the basics, very basics. What is the anatomy and physiology of cardiopulmonary system, which is again important in that aspect. Okay, so that's there. Now coming on to phase 2, that is more intense. That's more intense. Just a second. Yes, so phase 2 is more intense studying, where now you would be diving more into more complex things, as we said, pulmonary or cardiac rehab, or stroke, like diving into stroke. What is the kind of intervention of that stroke patient? What are the strategies which we can use with those patients? What are the synergy patterns? Yes, that's more of the second phase. Okay, and in your clinics as well, like if you have a patient who is going from acute to subacute phase, you are going to go slow, right? The progression towards that subacute phase is slow. We got to be cautious about any precautions or any contraindications, and then kind of dive in. So that's what we compare it with. And then the third phase is when a patient in your clinics is getting more stronger, because now you're working more towards the function and you're giving them more advanced exercises, right? So that is something which we would be doing. And then in actual course, what are we conveying it to? This is the time when we need final push. We need to revise. We need to work on the things which are more complex. So a lot of revision of what we did in the phase 1 and phase 2. So it's kind of a recap of 1 and 2, and then advanced intervention. Interventions is what we discuss in this at this time. Okay, so that's what, and preparing you for the exam, correct? So that's what we would be we do offer in the course, and that's how it's organized in a way that you don't feel overwhelmed in the very beginning, and you feel very prepared by the end of the phase 3 when you're ready to take this exam. And then we see obviously pass screens, right? Okay, so now I'm just going to tell a little few things. These are free resources for you guys. There are links, and if you guys want, I can kind of email them all to Terrell or in the email provided, and you guys can have access to all of these. So we have free Quizlet, an app, and Instagram page, which you might have already be on, or if not, then yes, we post questions on our Facebook and our Instagram page. So whenever you're ready, if you're not taking the exam in July, you're a second year student, then yeah, whenever you're ready for it, then go ahead and kind of start preparing accordingly. And we do have free podcasts, again, in which we discuss content and questions and a lot of other stuff, like how to prepare, what to expect in the exam, and all those things. So it's going to be really helpful for you guys to kind of go over the podcast, especially if you drive a lot and you would want to listen, or you like listening to podcasts as you drive to your work or home. So yeah, those are the resources. And then let's meet our NPTE Final Frontier team. So this is like from our CSM, where we click these pictures. So here, that's Dr. Singh in the back. Just a second. So that's Dr. Singh here, and that's Derek, who is responsible or taking care of all the enrollments and everything, and he would be the one who would be giving us the code for discount code. So that's there. And then all of the team members, you will see them when you are there. And also we do free classes as well, some of the free classes. And one of the classes which we do free is GATE, which you should not miss. And the information is on our website about that. Whenever that happens, you are always welcome to attend that, because it's so beautifully done and you will never forget your GATE once Dr. Singh teaches you GATE. His amazing way of teaching is like outstanding. I never had understood GATE as well as I had when I was studying for this exam. So that's something which I highly, highly recommend. So this is what we do offer, and who we are, that's what it is. And we are here to help you guys so you can trust the process and pass the NPT with pride. Okay, so that's what it is. So from my side, I am done. I would love to have our, go over any questions if you have for me today. And if you have anything you want to ask, let me know in the chat or howsoever.
Thank you so much for all of that amazing info. We do have one question in the Q&A. I didn't look at the chat yet, but it said all the products and the mnemonics and other handy memorizing tools, they're all included in the course?
Yes, absolutely. You will see them at different areas. Like we do discuss them in the live classes, or if you are in the study bundle, you will obviously get to know them, because Dr. Singh usually makes a point that he writes whatever is important from the chat on the main document, on the main screen, so that somebody who is in the study bundle also get to know. And we also kind of save the chats, so that, and especially we kind of screen them in a way that whatever is the good information, we keep it for the students who are not able to attend live. So yes, everything is given to you. There's a lot of support, email support. Again, if you're stuck in one or the other questions, if you're kind of going over the course, or you're going over any practice question which you're understanding, not understanding, you always can let us know. If you are getting all these practice exams, you are doing those practice exams and you need some or the other help, as I said, like, is it the anxiety which is keeping you down, or is it just understanding the reports well, like the report, whatever you get after taking the practice exam, you want to understand that, definitely everything. Like we have space for everything, and we have heart for everything, I would say, to help all our students. So yeah, that's what it is.
No, absolutely. Thank you for answering that question.
Yeah.
So last call for any questions. You can put them in the Q&A section or put them in the chat, and If you did not fill out the spreadsheet at this time, please fill that out before signing off. I'll stay on for about 2 or 3 more minutes for the anybody else that needs to fill out the form. Other than that, thank you for attending. Thank you again, Dr. Amreen, for all the excellent information. I'm getting chats from friends and stuff saying that they're definitely going to be looking into it and utilizing. Sounds like you have an excellent program. And also had a lot of fun hanging out with y'all at CSM as well. So if you are going to Boston next year, be on the lookout for NPTE Final Frontier as well.
Yes. And thank you everybody for joining in today, and be proud of yourself and what you're going to be after you're taking this exam. You would be a licensed professional soon, and you will be making so much positive impact in so many lives you don't even know. Right. So you will all pass and you will all do great and all the way best with whatever in the DPT program you are. If you're taking the exam in July, all the way best. And if you're taking, you're in second year, you're about to go into your clinicals, all the way best with everything which is coming ahead for you. And if you have any questions and if you're like not feeling comfortable right now, or it's kind of so late, you can always email me at this address or at enrollment at nptfinalfrontier.com.
Awesome. Thank you again. Like I said, I'll stay on for a couple more minutes. Otherwise, everybody else, you have a wonderful evening. Thank you again, Dr. Amreen.
Welcome. Thank you for having me.